Happy Tuesday. Thanks for joining us. I want to talk about a question that keeps coming up. I'll talk to patients about we'll be doing liposuction in their love handles, and in certain situations with a different shape, I'll talk about doing fat grafting to the butt. And everyone freaks out, oh my God, I don't want you to make this big butt, some, Nicki Minaj, Kim Kardashian thing. Hey, some people do want that, absolutely. But I want to talk about the other end of the spectrum of what we do with fat grafting to the butt. Very often, I'm going to say probably even most people, have some fullness in either the love handle, flank area here, and then a little depression here. Our patient today hardly has any depression, but you can see how there's a bulge, slight depression, and then a little fullness here. Now some people are much more pronounced with a very deep depression here. And what we're trying to do is get one smooth curve from a narrow waist. Some people call it snatch these days. I don't even think that's in the dictionary. Very narrow here, and then it comes out to one smooth curve. It doesn't have to be wide, but we want one smooth curve. So what I like to do is when I'm taking fat from here, fill in this depression on the side. What we have is very athletic buttocks with the glutes here developed, but it's a little bit depressed here. So the idea would be moving fat to smooth a shape, not necessarily making it bigger. So let me show you that. I'm going to use red to mark where I'm going to take fat, and green to mark where I would put it, to give you an idea. We've done a few marks, and what I've shown you is what we would normally do if we're just doing liposuction of the waist, for instance, along with the tummy tuck. Here's this area of the buttocks. You want the top of the buttocks to come right about to here. And so removing this fat is important, so you have bone, 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 and then a lot of people have a little fat pad here. To get a nice shape to the top of the buttocks, we need to remove some of the fat here, and of course here too. But we want the buttocks to have sort of a nice shape like that, so you can see how ideally we'd want to add some fat, especially for a perkier shape up high in this area. And usually what I'll do is add some fat into this area too, just about like that, to try to develop one smooth curve. So this comes in and this goes out. Now a lot of patients will say, oh look, I have a little bit of a bulge there. It's not so much, and hardly at all in this patient. Usually there is sometimes a small bulge and a big depression here. So if we add here, there's not much that needs to do here. And on her, I definitely wouldn't want to make the hips any narrower. So oftentimes we'll be dealing with hill, valley, hill by taking this hill down, adding to the valley to get the smooth curve. So these days I look at a waist in proportion to the buttocks. So it's oftentimes one procedure, a subtraction with an addition to get a more powerful waist-hip ratio. So it's not always about making the butt bigger. Usually it's about getting a more ideal slope and getting rid of this violin deformity. Thanks.